Thank you for joining this live town hall discussion hosted by Congressman Heck of Washington's 10th Congressional District. Tonight's guest is retired Vice Admiral Rocky Bono, the Director of Washington State's Pandemic Response. We've collected questions through social media and constituent mail, and we'll be using those questions to drive this discussion. If you're watching this live on Facebook and have a question, please ask it in the comments section of this video, and we'll answer questions from live viewers as well. Before we get to questions, I'm going to hand it over to Congressman Heck and then Admiral Bono for opening remarks. Congressman Heck.
Thank you, Lauren, and thank you all for joining us. This is the 16th in our series of teletown halls designed to provide you with information about the state's response to the COVID-19 pandemic. And tonight we couldn't be more privileged and grateful to have with us Dr. Rocky Bono, who is in charge of the state's response to that. When she was brought here initially, it was to deal with hospital issues. That role has expanded significantly since then. She comes to this position with an unbelievable career, frankly. She is a retired Vice Admiral. For those of us who represent Army bases and don't know quite as much about the Navy end of things, that's 3 stars. As such, she was the first female doctor in the Navy's history to achieve the rank of Vice Admiral. She has an undergraduate degree from, I think, University of Texas, a graduate degree from Washington State University in Spokane, and a medical degree, obviously, as well. She is by training and board certification a surgeon for trauma care, and yes, she has been deployed. Again, Dr. Bono, we're so very grateful for you being here. We have an unbelievably long list of questions that people have submitted. As the infections have spiked, so has the interest on the part of my bosses, the constituents in the 10th Congressional District, to find out more information. And we are so very, very grateful for your willingness to share. So if you'd like to say a few opening words and maybe a couple of 3 sentences about what exactly your job description is, then we'll get launched into those questions. And Lauren, I would like to get through as many of those as possible because there is a long list. Dr. Bono.
Thank you very much, Congressman Heck. This is a wonderful opportunity that you're providing me in terms of getting some of the information out, but more importantly, hearing directly from your constituents. And a large part of the work that I do is really in response to taking care of all Washingtonians. And so I welcome this opportunity to chat with some of your constituents and hopefully be able to share some additional information. Your support in helping us address this pandemic is so important. And part of what the governor invited me to do when he brought me here to Washington State, which by the way is a very lovely state and one that I'm truly enjoying quite a bit, is to make sure that we were number one, taking care of the healthcare workers and making sure that they were safe and taking care of all those who were coming down with COVID. The other thing was then making sure that we optimize all of our resources, whether they're health or medical or hospital or supplies, and making sure we could respond favorably to the pandemic. And then finally, taking care of all Washingtonians, not only for COVID disease and COVID infection, but other non-COVID conditions as well. And so large portfolio, but a very worthy one, and something that I'm really honored that I have a role in doing that. So Congressman, thank you very much for this opportunity. And I look forward to the questions. Thank you.
Thank you, Dr. Bono. Lauren, let's get after it.
Great. Our first question comes from Daniel on Facebook. At what level of daily new confirmed cases and deaths do we get to declare the pandemic is over? Dr. Bono?
Yes, that's a wonderful question, and it is something that we look at very closely because the numbers are so important. Of course, what we would be looking for is a reduction in the R0, which you probably heard, which refers to the effective rate of transmission. Right now, our R0 is greater than 1. It's at about 1.3, and what that means is that for every one person that's infected, more than one other person is going to contract the virus. What we would like to do is get our R0 below 1. And when we have an R0 below 1, what that means is we've got control over the disease. We're not there yet, and so we're closely monitoring that.
Thank you. Our next question comes from Melanie and was asked on Facebook. Have the sacrifices we've made since March made any difference at all? What are some success stories? Dr. Bona?
Yes, and I think that's, Congressman Heck, this is one of the first things I noticed about coming to the Washington State is the engagement of the community. It was so impressive because I know that at the very height of the surge and the crisis as the pandemic was unrolling, it really took the entirety of the state to participate with staying home and staying safe. And so those early efforts, they really helped flatten the curve and helped us get to that control that I was talking about. And we actually have the R0 below 1. But as we've loosened restrictions, we've noticed that the count of infections are starting to go up. And so I think that the real challenge here is how do we make sure that we retain and continue to pivot off of the early success and don't lose the ground that we created there.
So, Melanie, thank you for that question. I would like to add that in comparative terms, and these are not apples to apples, however, there is some relevance. If you compare Washington State, for example, to the state of New Jersey. Now, New Jersey is slightly larger, 15%, maybe 20%. New Jersey has, and you're hearing this correctly, more than 10 times the number of deaths. And most people would attribute that much lower rate in Washington State to the fact that Governor Inslee took early and strong action. Remember, we were ground zero for this, at least as initially thought, for the first infection detected and the first death detected. So in fact, the measures and the sacrifices, the incredible sacrifices that the people of this state have been willing to give has saved lives. And we're not talking about a few hundred lives. We're talking about thousands of lives. Lauren.
Thank you. Our next question comes from Randy and Lacey. What statistics are there for positive tests and deaths traced back to people participating in the recent Seattle protests, riots, and the Capitol Hill occupation? I have heard nothing in the news, but based on the medical information about COVID-19 spread I have heard, there should be data tracing back to those events by now. Dr. Bono?
Yes, thank you for that. And you know, we were watching with very guarded interest as well. But actually what we believe we're seeing in the spikes is actually associated more with some of the social events that we've seen, like Mother's Day and Memorial Day weekend. We've watched very closely where we've had some of the social gatherings and the rallies and demonstrations, and we've not seen a corresponding increase in the transmission. Nor have we found any types of positive cases being attributed or being traced back to the protests at this time. Now, it's possible with the ongoing protests that we might continue to see a rise in that, but we also have observed that many of the participants are wearing face masks, and we know that face masks help curb the transmission of the virus.
And Dr. Bono as well, they are outside. Would that not have been a contributing factor to the absence of data tracing to protests for an increase in infections?
Absolutely, Congressman, and thank you for bringing that up. We do know that you're at much higher risk in enclosed spaces, but when you're outdoors where there's more ready dispersal of the viral particles, then you're less likely to contract or become infected. Thank you.
Thank you. Daniel from Facebook asked our next question. Children under 20 years of age account for 10% of the confirmed cases, 1% of the hospitalizations, and 0% of deaths, according to the Washington Department of Health data dashboard. What data would support opening schools if this data doesn't already support it? Dr. Bono?
You know, that is a really complex question, and Congressman, you've got some very well-read constituents, and I appreciate that attention to detail. Those are very good. It's a very good question. I think the important part, though, about school and opening schools, and we have quite a few people that are actually looking at this because we recognize that it is so important for the social and educational and emotional development of children to be able to be back in school where they have a designed and structured curriculum. But we also know that it's more than the children who may be at risk here. And so we have to also make sure that we're safeguarding the environment for the teachers as well. And so I think that's another part of that. It's not only the students, but the teachers who need to be well protected. And it's also important to realize that even if the expression of COVID or coronavirus in children is less severe than for adults, they become a part of the transmission factors. And so when they go home and they get exposed to other members of their family, or if they're in a multi-generational home, then of course that risk that they bring home is the spread to perhaps their elderly grandparents or or to a sibling who may have some underlying condition, or even parents who might have another medical condition. So it's a multi-dimensional approach that we have to take and recognize that while the kids themselves are probably relatively safe, there are other considerations so that we can protect the rest of the people in schools, and more importantly, be able to contain the spread beyond the schools to the home situation.
Follow up, Dr. Bono. Can children be asymptomatic carriers without ever manifesting or presenting?
We believe that quite a few kids can have very mild symptoms, but can be just as infectious. And we also know that in adults, that they are the 4 days before they actually develop symptoms are the days when they have the highest viral load. And we think that that's associated or associated with increased transmission of the virus.
I'd just like the record to show that one of the two of us lives on the water, and we're being treated to some of the sounds associated with living on the water. That's not me, just to be very clear, Dr. Bono. I don't know specifically where you live, but I know generally where you live. Say hi to Stanley Siegel for us all. Okay, so back to this school issue, and I really appreciate the question, Daniel, because I think this is one of the more complicated, difficult, and challenging matters that we're going to have to deal with in the not too distant future. Obviously, children are going to be able to better learn when they're in a school setting with physical proximity to their teachers. That very proposition, however, presents with it a lot of risk. Dr. Bono has mentioned some. We should remind everybody that they would be indoors again, and potentially in more fairly crowded situations. The elements that would be required or that will be required in order to successfully undertake education all cost money and all put some folks at risk. For example, making sure that all the staff, and with all due respect, Dr. Bono, it's not just teachers, there are a lot of staff associated with undertaking an educational delivery system, having the appropriate amount of PPE, personal protective equipment, having the resources to be able to regularly clean in a way that is not traditional in school, all surfaces. And thirdly, transporting students to school. We have all these great big beautiful yellow buses that are designed to carry 62 kids, none of whom are 6 feet across. Any alternative to that is going to cost some money. And so each of the schools is going to have to take an approach of designing and trying to figure out on what basis can we do this, because we all recognize the importance of having an in-school experience where possible. And that will vary by district. I was on the phone earlier today with a woman who works in the Rosalia School District. They have like 139 kids in the entire school system from K through 12, and they have extra classrooms. Well, their capacity to be able to do this safely is a lot better than, for example, some more crowded suburban or urban schools. This is going to be very, very difficult. And I think it's going to be even more difficult as the number of infections continues to rise, if it does. Dr. Bono, is opening school at all at risk of this upward curve?
It is.
Not.
It is very much a part of the consideration, because if the disease burden continues to go up, it's going to have a direct impact on how safely we can actually open up the schools.
So the question of whether or not we will be able to open up schools, while school districts are hard at work at designing a way in which they think they can successfully undertake this, that question, however, is open at the present time, given the trend lines.
That's correct, Congressman. No, we don't have a final decision as of yet.
Didn't want to hear that. Lauren.
Thank you. Our next question comes from Mitchell on JBLM. I would like to know where you stand on Governor Inslee's face mask law, making it a misdemeanor to be out in public without a mask. As someone who currently serves the people of the United States and has sworn an oath to protect the Constitution as a U.S. service member, I believe this is a gross overreach of government power and an infringement on the rights of U.S. citizens and citizens of Washington State. Congressman Heck, would you like to comment first?
Well, Mitchell, first of all, and most importantly, thank you for your service. Anybody who is willing to put on the uniform for this nation is entitled to the gratitude of all of us, and I extend to you my gratitude, sir. Secondly, I think the issue of masking or not masking, unfortunately, has become highly emblematic, if you will, of this country's inability to talk with one another across divides, where we seem to have, unfortunately, and I'm not accusing you of this at all, sir, weaponizing these kinds of things such that we get polarized even more than we have. Now, that said, I just must respectfully disagree. The truth is that I know of no legal precedent, no court case, nor of any bona fide interpretation of the Constitution, which would suggest that in the time of a pandemic, under the emergency powers granted to our governor, that he is not within his ability or authority to require face masks to protect us all. At the end of the day, that is what that is for, to protect us all, so that R naught factor that Dr. Bono refers to does not continue to climb and climb and climb. Because let us remember that the closure, the induced closure of the economy was done by the governor in response to this. But the fact is that if we don't get the pandemic under control, it won't be a function of an executive order that leads to the economy closing down. It will be the result of the aggregated and collective decision on the part of lots of individuals who aren't going to go out because it isn't safe. And it is, unfortunately, in the last couple of weeks, increasingly less safe. So I guess I think about this, Mitchell, a little bit like a lot of other laws that we have that are designed to keep us healthy and that are consistent with our Constitution, our sacred constitutional parameters. For example, the authority for a state to invoke a ban on smoking indoors. Why do we do that? Because we know for a fact that secondhand smoke kills, that the incidence of cancer rises with the inhalation of smoke from cigarettes, and therefore it's constitutional. And in like fashion, masks keep us safe. They don't keep you safe so much as they keep the people safe who are around you. And lastly, I'll just say, if we don't get this pandemic under control, then, and I'll use these words, I don't believe they're hyperbole, and I use them advisedly and with no joy. The recession that we are in will become a depression. And I know we all want to avoid that. But Dr. Bono, I'd rather you spoke more about the medical science associated with this.
Thank you, Congressman Heck. And I think you touched on it. The reason that we wear masks is to protect other people. And, you know, you've already heard that I'm a surgeon. I wore a mask in the operating room to protect my patients. And that's what this mask does is because we don't know very easily sometimes who has the disease, we have to assume that just about any person is capable of spreading the virus. And part of the way of being able to control that is to have people wear masks, especially when they can't maintain 6 feet distance from each other. They're in an enclosed space. And especially if there's a lot of talking going on, because we do know that even loud talkers or people that yell, people that sing, that tends to create droplets and aerosolized saliva that oftentimes can be carrying quite a bit of the viral particles. And so the masks keep that contained so that they don't spread to other people. So as Congressman said, the mask is really to protect others. And it is so important. We have shown that some of our literature that if we can get to at least 95% of the population wearing masks, then we have a much more discernible decrease in the transmission, and we get to a better chance of containing this and preventing it from spreading much more.
Mitchell, again, thank you for your service. You've obviously given greatly to this country. I would only ask you to please consider continuing to give greatly to your country and your community by wearing a mask. Lauren.
Thank you both. Our next question comes from Ellen and was submitted on Facebook. The New York Times yesterday reported that we're only 68% toward our goal for testing. What are the plans to get to 100%? Dr. Bono?
You know, that is a great question, and it's not for lack of trying that we're not at 100% yet. But there are a couple of things that have been in play here, and what we've tried to do is those areas that we can take, that we have the most influence, we are doing the best we can to optimize those areas that we have control over. And in some cases, what we're dealing with here are the actual global supply for nasopharyngeal swabs or even some of the reagents. Now, in the early days, that was part of the challenge that we had. And so we had to actually change the way we wanted to test people by only testing people that have symptoms. But because the supply chain has opened up with the swabs, both the nasopharyngeal and just the nasal and the oral swabs, we're now able to increase our testing. But what we have found that as we've increased some of our testing, we're not the only state that has increased the need for testing. And so what we've also started to see is that there is a greater load or a demand signal on these national labs. And so they've gotten a backlog in that. Fortunately, in the state of Washington, though, we have several hundred labs here that when we look at optimizing their throughput, we can get to about 42,000 tests a day. And so we've started ramping that up. At one point, we had up to 18,000 tests a day, still short of where we'd like to be. But as we're doing that and we are actually getting to that higher number of tests per day, we found that while our supplies are intact for our swabs, we've started running out of reagents. And then the other piece—
Dr. Bono?
Yes, sir.
I apologize for interrupting. I know to the average layperson, because in some ways I am one, that term reagent doesn't have meaning.
Okay, thank you.
So I apologize for interrupting. Just for those who are watching,
yes, thank
can you explain what that means? It's a transport medium, right?
Yes, sir. Thank you. And I appreciate that. And please, anybody, please stop me because Congressman Heck's right. I'm using the technical scientific term. So there are actually three parts to testing. There's actually taking the specimen, which is usually that swab. It's like a Q-tip and it's like a giant Q-tip. And if anyone's had this test where they actually test your nasopharyngeal space, I've had it. It kind of feels like somebody's tapping on your brain a little bit. So they actually have to go way far into the back of your nose to get this sample. We have to use specialized swabs in order to do that. And for a while there, they weren't manufacturing enough of those swabs. The next step in testing is to actually put it in a transport medium. And we have to have a certain medium that allows us to take it so that the viruses don't die while we're sending it to the actual machine that runs the test. The machine actually uses chemicals that we call reagents that now take the virus particles off of the swab and into the machine so the machine can read whether the virus is there or not. So while we've improved the swabs in the first part of the testing, as we've increased the number of tests we've done and we've brought them to the machines that actually run the test, we're finding out that the chemicals that we need to extract the viral particles off the swab and into the machine have started running low. And so we have to replenish that. And then the machines themselves, we have quite a few machines and we can actually increase the throughput. But as I mentioned, the chemicals, the reagents are starting to run low. And then there's one other thing too, and I know this is another complex issue and I'm giving you a lot of details, but I think you would want to know all the steps that are included in testing, is that we have to make sure that whoever's doing the test are protected from actually getting the virus. And so they need to be wearing certain PPE themselves, the mask, the gloves, the gowns, the eye shields. So, and I think many of you have probably heard about the PPE shortages. And so that's another aspect of it. But in spite of all that, the governor has made every effort to get all the supplies and equipment that we need in order to run as many tests as possible. And we're actively working by each county to make sure that we're getting as much testing supplies and chemicals and reagents and access to the machines to actually run the tests. So while we're not at 100%, we are gradually making our way there. And I think it's no surprise to anybody that, especially for me, we're not moving fast enough, but we're doing everything we can to get up to speed.
Dr. Bono, you said we were up to 18,000 in the last week. What's the average number of tests per day?
So in the last week, we've been actually averaging about 10 to 11,000 tests per day. And
optimum would be what?
Optimum would be, I would rather us see us closer to 20,000 per day. And then at full capacity, that would be 40,000 a day.
What's the average turnaround time on test results? I'm married to a middle school teacher, and what I learned that mere 44 years ago when we got married, and she brought home a stack of papers that thick every night, was if you don't give immediate feedback to the kids, it doesn't do much good. So I tend to think the same thing about a COVID-19 test. If you have to wait for a week, all the value and utility of being able then to contact trace is gone. So what is our average turnaround time?
Very good question. And not only do you need to have immediate response so that it has impact on your ability to do case and contact tracing, but we also find out that some people are not isolating while they're waiting for the results of the test. So if they're positive and they don't know that yet, and they're not isolating, then they're out there spreading the disease. So we're finding that the out-of-state labs are averaging anywhere from 5 to 7 days. But here in the in-state lab, so exactly, that's way too long. Here in the in-state labs, we're finding anywhere from 24 to 48 hours, which, whilst, it's more optimum than the 5 to 7 days. So our preference is to use the in-state labs.
And of the current capacity, set aside momentarily the reagent shortage that seems to be choking this, what is the in-state lab capacity?
The in-state lab capacity at maximum is about 44,000 per day.
Oh, spectacular. Lauren.
Thank you. Our next question comes from Carolyn, who is watching live. The Trump administration announced that hospital data on COVID will no longer go directly to CDC, but will go to HHS instead. What can Congress do to stop this? It's imperative that Congress, scientists, medical providers, and the public have accurate and timely data. Congressman Heck?
Well, first of all, I couldn't agree more. One of the most important cornerstones of dealing with any kind of a public health threat is that you have both transparency and accuracy of data to the maximum degree that is possible. There is absolutely nothing about the seriousness of a virus that has now taken 140,000 of our neighbors' lives and infected I don't know how many millions at this point. That should in any way, shape, or form lend itself to withholding of the data or to the politicization of that data. What can we do? We can pass a law, we can pass restrictions, and there have been measures already written up in response to the administration's announcement. However, I have to just tell you in all candor that we can pass all the laws we want. It requires the good faith implementation of those laws in accordance with our Constitution. And I wish I could be more optimistic for you. What can we do? Everything we can. Will it matter? It remains to be seen.
Thank you. Our next question comes from Susan in Tacoma. Is there enough PPE? Was the state able to stockpile any? And are American companies still making it? Dr. Bono?
Thank you for that question. That was something that was quite a bit of a concern early on. Not only were the major manufacturing companies not able to keep up with the overall demand, but we were also having challenges in terms of being able to get some of this equipment or the PPE from overseas sources. We are now in a much better position here, and we've actually started stockpiling. I'm working very closely with the hospitals and the healthcare system here in the state of Washington to look at how we can pre-position some of our PPE in certain hospitals and in various counties where we know that there's a higher risk of transmission and a higher need for testing. So we're doing better in places with gowns. Gloves, we're doing well. What we're running into a problem though with some of the gloves and some of the gowns is that we need to get larger sizes. I understand that for the gowns, we need to get 2XL, and we've been mostly getting larges and mediums. Same thing with gloves. We actually need some of the larger sizes for gloves. Our N95 masks, we're doing pretty well with that. And certainly our surgical masks, we're doing extremely well. So I think in terms of PPE, we're keeping up with the current demand, but we're actively also in a position where we can start looking at stockpiling our PPE.
Thank you. Our next question comes from Lucas, who is watching live from Olympia. When can people who earn Social Security disability income receive their stimulus money? Congress has passed several stimulus payment bills. Congressman Heck?
Well, actually, we've only passed one stimulus bill into law, that which provided, I think, $1,200 per individual. And my recollection is that there is a place, I believe, Lauren, you may recall this better than me, on the IRS website where you can go and track down whether or not that is in process. But I hesitate to say too much because my memory is failing me at the moment. Short of that, what I would suggest is that you call our office, and before this town hall is over with, we will provide you with our office number so that you can call up. We have people specifically who are available to work with constituents on matters just like this. So that's the best recommendation I could give you. I know that many of the checks have been sent out, if not most, but there are a whole bunch that are in process, and fairly vague indications from the administration as to a date by which they will all be processed. So please call our office and we can walk you through the steps.
Our office phone number for those listening, if you are looking to call our Lacey office, the phone number is 360-459-8514. And our Lakewood district office is 253-533-8332. And people will be happy to help with that. Our next question comes from Jacob in Olympia. Governor Inslee held a press conference where he announced a budget shortfall of over $8 billion. As a state worker, this is going to require me to take furlough days and will have significant impacts on my personal budget. During his press conference, the governor made a plea to our representatives in Washington, D.C. to support states so we can continue our important work moving forward. I look forward to your leadership on this issue. Congressman Heck, would you like to comment first?
Sure, Jacob, thanks very much for the question. Thank you for doing service for the people of our state. So you will recall that in the CARES Act, there was approximately $150 billion provided for state and local governments to help them offset the costs that were directly associated with expenses related to the COVID-19 pandemic. In the HEROES Act, a separate bill, which passed more recently out of the House, but is not yet passed the Senate, there was a much bigger figure of assistance available for local and state government. There was $500 billion for state governments, which would have translated out to quite a bit of money for Washington state, as a matter of fact, to help the state make up for the revenue shortfall associated with the economy going into decline. So that HEROES Act in total was $3.2 trillion, just to give you a bit of a context, $3.2 trillion. The Senate has recently said, and remember, they have not taken up the HEROES Act, they're willing to do $1 trillion. So now we're at a point where they're indicating we can do $1 trillion in aid, unspecified. They haven't yet committed to state aid. And as a matter of fact, when this issue first came up, you will recall that Senator Mitch McConnell, the majority leader, said it would be okay with him if states went bankrupt. Well, the reaction was so swift and so broad and so deep that he kind of had to walk that back, as frankly, a lot of state governors, including members of his own political party, were calling him on the phone and saying, we're in really deep trouble here. You're talking about a reduction of services to very vulnerable people. And it kind of warmed the Senate up. So they have signaled a willingness to do something. They're at $1 trillion overall aid, and that would include a lot of other kinds of elements to deal with the recession, like extension of unemployment and a lot of other things, additional money for testing. There was quite a bit of money in the HEROES Act for that, $125 billion, as I recall, to help with all these kinds of efforts that Dr. Bono has indicated. So they're at $1 trillion, we're at $3.2 trillion. The negotiations are just beginning. Originally, we hoped that this would be done by the end of this month, July, but now it appears as though it may actually seep into the very first part of August. So the answer to your question is, negotiations are underway. The House has established a strong position for a large amount of aid to local and state governments. The Senate has reluctantly come around to indicating that they will do something, and we'll see.
Thank you. Our next question is from Stuart in Olympia. I'm a local union construction supervisor that builds roads in Olympia. Usually in June, I would be working 60+ hours a week, making good money. The last 3 weeks, I have literally worked 10 hours per week. This is a lingering effect of the COVID crisis. We must extend unemployment insurance as it is the only thing keeping people from losing their homes and keeping their families fed. Please, before you leave Congress, put up a final fight to extend unemployment until January. Congressman Heck.
Will do, Stuart. In fact, the HEROES Act did extend unemployment compensation to, I think, next March 31st. The truth of the matter is we're still dealing with north of double-digit and 10% unemployment. And the truth is that this is not likely to abate very swiftly or for a very long period of time. So one of the battles that will be undertaken in this negotiations that I indicated earlier has begun is, do we extend unemployment compensation, and if so, in what form? I am cautiously optimistic that we will do that, but it is one of the points of contention between the House and the Senate that hopefully, again, will be resolved in the next 3 weeks.
Thank you. Our next question comes from Norman, who is watching live. Who will pay for the COVID test in assisted memory and rehab units if they are to make testing 2 times a month? Dr. Bono?
Thank you for that question. And thank you also for giving me the opportunity to talk about the care for our guests in the long-term care facilities, our residents, and our staff there. Many of you appreciate that they represent one of our more vulnerable populations. And so we have a very dedicated effort to make sure that we understand what their disease prevalence is. And that means how prevalent or how present the virus is in their facilities. And then what's the likelihood that they might transmit it to each other or among the residents in a long-term care facility. So as we're looking at testing, which is an important part of how we make sure that residents in long-term care facilities are safe and that the virus is not being transmitted. We're looking at of course, testing. Most plans will cover testing if people are symptomatic. And we're also looking, though, at a combination of how we can cover surveillance testing, whether that's something that the state can cover or whether some of the long-term care facilities organizations themselves will help with that. And then also talking with the insurance commissioner and the healthcare plans themselves to see if that's not something that we can also find ways to cover. I think the important thing is that it's so important that we're actually able to track the progress of the disease. And right now, our only means of doing that, besides waiting for people to get sick, is to test. So I think that this is one of those areas where the governor is extremely invested and interested in finding ways that we make sure that people get the tests they need. But we are, candidly, we are having to find a variety of different solutions in order to make that happen.
Dr. Bono, I'm going to ask you the question I know you hate to get, but it is what is on everybody's minds, Dr. Bono. Your opinion, and it is just that, but as a medical professional and somebody who's following the literature very close, the vaccine. Because ultimately the vaccine is the fix for this. And we know now that there are multiple human trials underway by a variety of companies. When you read the literature, when you talk to your colleagues, what do you come away with as of this week?
So this is just my opinion, but you're right. I have been following the literature and talking to my colleagues quite frequently about this. Out of the 100 and nearly 50 efforts that are ongoing there, we now have about 3 that are ready to go into phase 3. And phase 3 in the development of vaccines is when we want to enroll as many people as possible to see if the vaccine is actually safe. What that means is in phase 1 and phase 2, we've been able to determine that whatever approach we've used to build a vaccine has actually created the antibodies. That's phase 1, is to create actual antibodies. Phase 2 is then to try it on a small sample of people to make sure they don't get sick or don't have a bad outcome to the vaccine. Phase 3 is where you have to enroll thousands of people into a trial and make sure that the vaccine actually does what it's supposed to do and it doesn't create an additional illness or a more severe illness in people. So we have at least 3 vaccines out of the 150 plus that we started with that are now ready to go into phase 3 trials. I understand there may be one or two more that are getting ready to do phase 3 trials as well. The challenge, however, is that we don't know for how long. We do know that these vaccines that are going into phase 3, we know they're going to create antibodies in people that are given the vaccine. We don't know how long those antibodies will last in your system, in your body, nor do we know if those antibodies will be enough to fight off the coronavirus. So while I think the work needs to go on, and I think that we've made tremendous progress in a relatively short period of time, my personal thought is that we can't rely on the vaccine as something as the magic bullet or the cure-all. And I don't think we'll even have very clear answers until late in 2021, whether or not the antibodies that are created actually offer some kind of protection, and that we even have an understanding of how long those antibodies stay in the body. So I'm cautiously encouraged by the progress, but I think pragmatically speaking, I don't know that we can count on the vaccine as a cure-all for coronavirus.
Until no sooner than late 21 is what I heard you say.
That's right, sir. I don't think we're going to know very much until late 2021. And if we are able to scale a vaccine, an effective vaccine, and we can make millions of the vaccine at a time, I think really the leadership of the country and the world will have to decide how to prioritize the vaccine and where we need to send the vaccine and administer it to, and in my opinion, to probably the most vulnerable people.
And it's not millions though, really, is it, Dr. Bono? It's billions.
Billions. Yes, sir.
Billions of doses, billions with a
Yes,
B.
sir.
You can get this bad stuff twice, can't you?
You can't. Well, I think that's what we are anticipating, is that I think with similar to the flu vaccine, when we make the flu vaccine, it's usually on last year's strain. We hope to be able to give some type of immunity to at least 60% of the population that gets the flu vaccine. We think this is what's going to happen with the coronavirus, so it's quite possible you could catch it again.
There have been recorded cases, documented cases of people having it twice already. Lauren.
Thank you. Our next question comes from Aaron, who is watching live. What support can students, K-12 and college, who do not have health insurance get in order to help pay for COVID tests? Students' access to tests, regardless of ability to pay, is crucial to understand who and where the virus is on school campuses. Congressman Heck?
It needs to be free. That's what we provided for. Testing should be free. I hope that that will become a part of a final package that we contemplate here in the next 3+ weeks. It should be free. And the reason it should be free, by the way, is that it's to everybody's benefit, because the more people that are tested, the more people that can be identified and therefore isolated, the more contact tracing. That's how we defeat the virus, short of a vaccine or a completely effective therapy. That's how we win, is by making sure as many people as possible are tested. So it should be free.
Thank you. Our next question comes from Janine on Facebook. What plans are the state and county level health departments making for the potential increase in contact tracing requirements when schools are due to start in September? Are more personnel being hired and trained? How are the health departments being advised to proceed? Dr. Bono?
That is a really good question, and it's very timely because we're actually actively working those numbers now. We know that in order to get a better idea of where the virus is going and who is at most at risk for contracting the virus, we need a very robust case and contact tracing capability. And so we've brought on quite a few of the National Guard, and we've trained them, and so they're out there helping us with this case and contact tracing. We also have a fair number of Department of Health employees that are also trained to do this. But we can always use more help. And so we are looking at services that actually are trained to do this case and contact tracing and can do the interviews and do them well, and then be able to augment their interviews with digital tools that help us create that database that allows us to see who has the potential or who has potentially been exposed, and if they have themselves potentially exposed other people. So it's a combination of the personnel that we brought on. We have at least 1,000 people now. We know we need to maintain that level. And so we're using a combination of bringing people on, contracting them, and providing full-time equivalents, FTEs, assistance at the local health level so they can do the comprehensive case and contact tracing that they need to do.
Dr. Bono, can the average citizen volunteer to participate in this if they're not attached or associated, for example, with something like the National Guard?
You know, I think that there would probably be a role for this. I know one of the areas that we had looked at was some of the nursing students and even some of the pre-med and medical students to see if they could be trained. Of course, you know, many of them are trying to start back some of their own studies. But I think that in terms of volunteers, I don't know exactly what the Department of Health has, but I can get that information to you. And if we do have an opportunity for volunteers, would love to see if some of your constituents would like to be a part of that cadre.
Thank you. Lauren.
Thank you. Our next question comes from Patrick, who is watching live. What will be done to support childcare in our state? So much is needed towards long-term solutions, as well as immediate help for childcare businesses to stay open for children and families. Congressman Heck?
Well, thank you. Actually, I kind of lumped together both the issue and the challenge of childcare along with opening of schools as it relates our ability to proceed forward safely and in a way that will enable the economy to function as well as it can be within the context of a pandemic. Legislation is being introduced. In fact, I co-signed on to legislation this week to provide assistance in the area of childcare. It is to some degree an issue of resources so that the safety elements can all be in place. That is to say, the cleaning, the masking, and the testing. But the truth of the matter is, once again, you're talking about little people who are in a confined space and less likely to keep that mask on quite as often as they should. That's going to be a challenge in and of itself. And everybody who's ever had a 3-year-old child or grandchild knows exactly what that's about. So it is a big challenge, and it's part and parcel of the broader issue of how we're going to deal with people who have children, who maybe work in a profession where they are able to go back to work, and whether that's in home or out of home. Because the truth is, as those of you parents who are watching know, that have had to balance both caring for your children in your home, maybe homeschooling them or assisting them in that regard, along with your job duties, this is incredibly challenging. And it is one of the greatest strains, frankly, on households and families.
Thank you. Our next question comes from Warren in Lakewood. My question is, why and when can the YMCA and libraries open? I understand the virus concern, but have seen gyms and gymnastics centers open with many people. My point is, if health is important, these should open by now. The library is needed to apply for unemployment benefits, look for a job, or contact friends or family. I think a gym is more important for reasons already described. Some of these other non-essential places have been open the whole time. Gyms and libraries are not only recreational, most people need the mental and physical benefits. Dr. Bona?
Thank you for that question. And you know, that is something that the governor has also encouraged many of the Washingtonians, is that when you can, make sure that you're keeping up your exercise. And so I think that, of course, we've had to shut the gyms down, and we've been very cautious about opening the gyms. And I'll start off with the gyms first. Part of what we've realized with this is something that I've mentioned earlier, and that is we know that there's a higher propensity for spread. That is, you're more likely to get the virus when you're in an enclosed space. Many gyms are in an enclosed space and are not necessarily outdoors. But the other piece that we've also discovered is that when people are working out, they tend to create a much larger aerosol cloud around them. And when you have a large number of people in a gym who may be infected and are creating these aerosolized clouds of their saliva or their droplets as they're breathing hard or increasing the amount of their mouth breathing, that there's a greater risk of you contracting or inhaling the viruses in that situation in an enclosed gym. So it's been one of the areas that why we've taken a very strong stance. I'm sorry for the, not only do I have seagulls, I have emergency vehicles around too. I'm sorry. So we also know that gyms are a particular area where you can, the risk for catching the virus is actually much higher. And so that's why we've taken a much more conservative approach. We also know too that especially in gyms where there's a high use of people touching the machinery and weights being changing hands, that being able to keep a place like a gym disinfected from multiple users is extremely challenging. And while it's on a lower risk scale, we do know that in some cases the virus has been transmitted off of solid surfaces. With regards to the library, again, the piece of that is being in an enclosed space. In some of those places where we are able to loosen some of the restrictions, we've been able to do so by decreasing the number of people that go into some of these buildings and some of these organizations. And that would be what we would need to look at in libraries, is to reduce the occupancy of that building before we would say that it would safe to utilize that. So I appreciate the question, and I know that being able to have access to those things is an important part, but we are trying to weigh the risk to your health in that, and gyms we've realized represent a higher risk than we feel is necessary for maintaining your safety.
Thank you. Our next question comes from Bridget in Rainier. Airlines are flying people into Washington from states with elevated levels of COVID-19. What protections do we have from this? Congressman Heck?
Not enough is, I suppose, Bridget, the bottom line on that. Obviously, that there are places in the country or places in the world where the testing is much more robust for people getting on and getting off of airplanes, such as doing temperature tests. I have had occasion to fly a couple of times during the COVID-19 close down back to Washington, D.C. to vote, for example. And we know for example, that a significant number of TSA employees have actually tested positive. And so it begs the question as to whether or not you are safe going through those lines coming into contact. We are implementing increasingly protective measures, but they're not enough. They're not fast enough. And again, just like an awful lot of the other things we've talked about, Bridget, this is a function of resources. And the HEROES Act did provide funds to enable us to better do this. Again, stay tuned for the next 3 weeks.
Thank you. Our next question is from Anne, who is watching live. Dr. Bono, what are some of the underlying medical conditions that are causing increased risks for death?
Anne, thank you for that. So we do know that people that have any type of other medical condition puts them at a higher risk for having a more severe reaction to the viral infection. Typically, these are people that have lung conditions like COPD or emphysema. Also, things like diabetes or even heart conditions can raise a person's risk, who would catch the disease, catch the virus, and then have a more severe outcome because of their coexisting conditions. Even ongoing infection, something that you might have that might seem relatively minor in most cases, once the coronavirus is also part of what's happening to your body, we found that it's the physiological or the body's ability to really fight the infection gets markedly weakened if you have other conditions.
So anybody, in other words, Dr. Bono, who is immunocompromised in any way, but especially people who have a respiratory condition.
Yes, sir.
Is that?
That's exactly right. So any kind of immunocompromising, even something like lupus or HIV would put you at higher risk. We also know too that people over the age of 60 can be in that high risk category as well.
Thanks for that.
Nothing personal.
Lauren.
Thank you. We are almost out of time, so I'm just going to ask one last question, and then I will turn it over to the two of you for some closing remarks. Our last question comes from Cheryl and Lacey. I see that the White House has announced the withdrawal of the United States from the World Health Organization. Isn't that a matter for congressional approval? Can your office give any insights on U.S. domestic law concerning such an action? And what are your thoughts? Congressman Heck?
Thank you. So I try not to talk either in hyperbole or in personal terms, but I'm going to be very blunt with you. Of all the boneheaded ideas that have come along, the idea of withdrawing from the International Health Organization in a time of a pandemic takes the prize. That's my frank and blunt assessment of it. Now, here's the good news. He actually announced that that wouldn't happen, I don't believe, until next year. It's supposed to be on some kind of a phased basis. The fact is that he still has to follow the law and the directives as contained in the budget. And I would put the chances that Congress would withdraw its support of the World Health Organization at slim and none, and slim just left the room. So I think you can count on continued and strong advocacy. There have been very few ideas that have been met with more derision and criticism than the idea that we would pull out of the Global Health Organization at a time when we are globally trying to combat the virus. I just want to remind everybody that in years past, the World Health Organization has played an incredible role in helping us to deal effectively and preventing the spread of the virus. And this is a new one. This is a particularly pernicious virus, and we need them even more to help us guide our way through this and to prevent the damage from being any greater than it is. I am quite optimistic that this proposal to withdraw will never come to pass.
Thank you.
Dr. Bono, you're biting your lip.
I am. I'm letting you do all the talking on that one.
You're letting me do the talking because you agree and you just don't want to say it out loud. Okay. Smile if you're agreeing with what I just said. Aha.
Thank you.
Lauren, time to wrap up?
I'm going to slip one last question in here for you.
Sure.
This one comes from a live viewer, Dawn. Given the divide between a Republican Senate and Democrat House that seems to be growing apart by the day, what meaningful help can Americans really count on over the coming weeks and months? Is there light at the end of this bleak tunnel? Congressman Heck?
Yes, and I hope it's not an oncoming train. Well, look, we're a very polarized nation, and it's pretty painful. Most of you watching know that I've announced my retirement from Congress, in part because, frankly, I find the institution and the environment to have become just more than I'm willing to put up with, in addition to being away from my wife most of the time. But that said, let's remember that there have now been 4 bills of major consequence that the Congress has passed in a highly bipartisan way to deal with the virus, including the CARES Act. And Dr. Bono has mentioned several instances where that has come into play and have been of value. The fact is that we are now in contentious negotiations. I think we're going to get another bill, as a matter of fact. Whether or not it is all of my liking or all of somebody else's liking, well, of course, that remains to be seen. But Congress did manage to step up and act very swiftly when the virus first hit. In fact, so swiftly that we didn't get a lot of things right. We had to correct them in subsequent bills, and there were implementation issues. But again, we were trying to halt a literal free fall of our economy in the face of the virus, and we acted in a bipartisan way. And I hope beyond hope, and I pray that we'll be able to do that again with whatever version of CARES 2.0 or the HEROES Act or whatever name you choose to assign it, will actually provide the resources and the direction for this nation to be able to deal much more effectively with the damage that's been caused by COVID-19, and hopefully get us back on track to something akin to normalcy as soon as is possible. Lots of people out there are hurting. They've lost their businesses, they've lost their incomes, they're at risk of losing their homes or the apartments that they rent. And I think it's incumbent upon elected officials at all levels of government to do what they can to help. After all, that's the point of government, especially when things like this happen for the government, which is another way of saying all of us together step up and help.
Thank you so much. And that will conclude our town hall with Vice Admiral Bono. Now we'll turn it over to Dr. Bono for any closing thoughts before the Congressman closes us out.
Congressman Heck, thank you very much for this opportunity, and I really enjoyed the questions. There's a lot of depth from your constituents and a lot of very close attention that they're paying, and I think it's your people like those that are in your constituency are going to help us really get on top of this and help us do what we need to do to control this and make this safer for everybody. So thank you very much for this opportunity of sharing this information and having the conversation. And thank you for all that you're doing to help us get safer. It's very much appreciated as we're all working very hard to try to do the right thing for everybody else. So thank you.
Dr. Bono, thank you very, very much. Thank you indeed for your 34 years of service to this nation, Vice Admiral Bono. And thank you for your service to Washington State as we attempt to deal with the COVID-19 pandemic. Thank you to those of you who are viewing. As I like to say, you have given of your most precious commodity, your time, and it is deeply appreciated. If you have follow-up questions, again, we gave the numbers out earlier. They're easily available or accessible on the internet. Feel free to call our office. Stay tuned for announcements about future town halls. Again, this was our 15th. I'm certain that we'll have another one in the not too distant future, but I'm equally certain that we could not have possibly had a better, more expert guest than Dr. Rocky Bono tonight. Thank you again, Dr. Bono, and thank you all for watching.